I'm Dr. Thomas, and I will be guiding you through this colon today. Also known as the large intestine, the colon is responsible for the final stages of the digestion. It absorbs remaining water and electrolytes from indigestible food. Exception stores food remains that weren't digested in the small intestine and eliminates solid waste from the body. A colonoscopy allows your doctor to view inside your entire colon using a device called an endoscope. As the scope moves into your colon, your doctor views the output on a monitor to check for growths or polyps. There are several parts to the colon: the cecum ascending the transverse, the descending, and the sigmoid. A colonoscopy can check each one of these areas. The one thing about having a colonoscopy is that a doctor can find polyps and remove them immediately. This is the most effective way to prevent the development of colorectal cancer. However, you'll need to cleanse your colon 24 hours before the test by taking laxatives or performing a fleet enema. Also, use of the endoscope might accidentally tear the colon walls and cause bleeding. Plus, you'll need to be sedated during the exam, which should take about 30 minutes or longer. If any polyps are found, we have a 53-year-old female waiting for her colonoscopy. Let's get scrubbed and take care of this. Our patient is lying on her left side, knees drawn up to her stomach. She's wearing a gown and we have a sheet draped over her. Let's set her up with an IV drip of the sedative. Great, now we'll wait a few minutes for the sedative to take effect. Our patient is sedated and ready. He stated that she's cleansed her colon, and I've already used a lubricated gloved finger to check for blockage. Be sure to tell the patient that she should breathe slowly through her mouth to relax her stomach muscles. If she feels cramping, we'll insert the endoscope into the anus and slowly move it into the colon. The endoscope contains a small camera and light, and a pair of forceps so we can remove any polyps we find first. Let's lubricate the scope for easy insertion and passage through the colon. Insert the scope into the patient's anus and slowly move it into the colon. We can watch the camera's output on the monitor. We're into the rectum now, nothing so far. Let's move on into the sigmoid colon. Slow and steady. You're doing a great job. Descending colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam. All right, let's move into the transverse colon. Uh-oh, looks like we've got a small polyp in the transverse colon. We'll use the forceps to remove it. Fine. Work. We'll need to remove the scope so we can bring the polyp out first. Let's use some heat to cauterize the spot and try to stop that bleeding. Fantastic. Let's slowly withdraw our scope and get that polyp out. Let's go back in to check the rest of her colon. Remember the name of the colon where we found the polyp. That's right, the transverse colon, back in the transverse colon. Now everything's looking fine and you're doing a great job. Now's also a good time to remind our patient to breathe through her mouth, slowly moving now into the ascending colon. And there's another one. Let's take it out. The same way we did the other foreign colon now, and we move into the cecum. And all looks good. Let's take out the scope and get our patient into a recovery room. Our patient is now in recovery, and she'll probably be there 1 to 2 hours. She might feel bloated or need to pass gas. And since we removed 2 polyps, she'll probably have a small amount of blood in her stool. We'll also do a biopsy on the polyps. She should call her doctor immediately If she has heavy rectal bleeding, lower abdominal pain develops. A fever, feels dizzy, vomits, or experiences swelling in her abdomen. Colon cancer is one of those diseases that falls into two extremes. On one hand, it's highly preventable if caught early. On the other hand, it's extremely dangerous and hard to treat once it progresses to later stages. What makes this more alarming is that colon cancer is becoming more common in younger people, not just those over 50. In fact, according to the National Cancer Institute, it's now the #1 cause of cancer-related death in people aged 20 to 49. That's a major shift and a major reason why awareness matters more than ever. Let's put this into perspective. If colon cancer is caught early, when it's still localized, the 5-year survival rate is around 91%, but if it spreads to other parts of the body, the survival rate plummets to just 13%. This means that recognizing the warning signs early can quite literally save your life. So what is colon cancer exactly? It begins in the large intestine, also known as the colon. Most of the time, it starts as small, non-cancerous polyps, tiny growths that can become cancerous over time. The good news is, if these polyps are found during a screening, they can be removed before they ever turn into cancer. That's why screening is so important. It's not just for diagnosis, it's also a preventive measure. Let's dive into the symptoms, starting with one of the most common. Changes in bowel habits. Occasional constipation or diarrhea is usually harmless. But if you notice ongoing changes that last more than a few weeks, like persistent diarrhea, constipation, or alternating between the two, that could be a red flag. This happens because tumors in the colon interfere with its natural job, absorbing water and forming stool. This disruption can lead to diarrhea, constipation, or both. Next is unexplained weight loss. If you're losing weight and can't point to any changes in your diet or activity level, it could be a sign that something's wrong. Colon cancer can cause weight loss in two ways: by interfering with nutrient absorption and by redirecting your body's energy to support cancer growth. If this sounds like you, don't ignore it. Another important sign: blood in your stool. This is a big one. While bleeding can result from something relatively harmless like hemorrhoids, it can also signal something much more serious. Any kind of blood, whether it's bright red or darker, should be evaluated by a doctor. And on that note, if your stool looks black or tar-like, it could mean internal bleeding from higher up in the digestive tract, possibly even from the right side of the colon. Don't dismiss it. A lesser-known but critical sign is iron deficiency anemia. This happens when slow, chronic blood loss from a tumor in the colon depletes your body's iron levels. You may not see any blood, but over time, this type of bleeding causes anemia, leaving you feeling tired, weak, or short of breath. If you've been diagnosed with anemia and you're not sure why, especially if you're a man or a postmenopausal woman, it's important to rule out colon cancer. You should also pay attention to a persistent feeling of fullness after a bowel movement, or the sense that you didn't completely finish. This is known as tenesmus, and it can happen when a tumor located in the lower part of the colon or rectum mimics the sensation of needing to go. If that feeling sticks around, don't write it off as just digestion issues. It needs to be checked. Frequent bloating or excessive gas is another symptom to be aware of. As tumors grow, they may partially block the colon, trapping gas and slowing down digestion. This creates pressure, bloating, and discomfort. If you're experiencing this regularly, without any recent changes in diet, don't ignore it, especially if it lasts for several weeks. Here's something that might surprise you. The most common early sign of colon cancer is actually nothing at all. That's right, colon cancer can grow silently without causing any symptoms until it's quite advanced. And that's why screening is so essential. The best time to detect colon cancer is before symptoms appear. So when should you get screened? In the United States, The general recommendation is to start screening at age 45, even if you're healthy. If you're at higher risk, say you have inflammatory bowel disease like Crohn's or a family history of colon cancer, you may need to start even earlier. Some people should begin screening as early as age 25, depending on their risk factors. The most effective method is a colonoscopy. It's both a diagnostic and preventive tool. During the procedure, doctors can spot and remove any polyps before they turn into cancer. If you're not comfortable with a colonoscopy, there are other options, such as at-home stool tests that look for blood or abnormal DNA. These tests are less invasive but need to be done more frequently and aren't as thorough as a colonoscopy.